opioid analgesic, and it's for strong pain relief, and its dose is between 5 and 20 milligrams, and some side effects are nausea, respiratory depression, and circulatory depression. Okay, all right, and we'll just go on with the
Hi, how are you? My name is that's good. My name is Master. I'm a student from UWS. I'm assigned to look after today. Is that okay with you?
Yes.
Okay, excellent. Okay, let's start off with your name and date of birth. Could you give me your name and date of birth?
Miriam Ate,
Yes, and your date of birth is?
7/1/69.
Excellent. And your MRN is 174963. Very good. And have you got any allergies?
No, thank you.
No allergies? Excellent. And has anybody given you any medication today?
Not yet.
Okay. So I've just had a little look and I see that the doctor's written you up for some pain relief. Do you have any pain at the moment?
Yes.
Okay, and whereabouts is it?
On my chest.
Okay, very good. And if you were going to scale it from 1 to 10, what scale would you give it?
8.
An 8. Okay, so that's pretty severe. I will get you some medication really quickly. I'll give you the buzzer in the meantime so that you can ring me if you need to. And yeah, I'll be back with the things. The morphine itself, which is the medication you've been written up, might make you a bit sleepy and it might make you a bit nauseous. So we've actually we've got another medication for that written up for you. So we'll start on the pain relief first, okay? Thank you. Thanks. Miriam, before we get the medication, I will just check your vital signs, just to make sure we have a baseline. Okay? Thanks. Okay, so would you be my second RN? I just need to do a drug verification. I have been given Miriam Adi today, and she is, her date of birth is 7/1/69. Her MRN is 174963. She has come in with broken ribs, and she has no known allergies at the moment. She's been written up for morphine. She has a pain of 8 out of 10. It is in the chest area, which is correct. She's been written up for morphine 50 milligrams per 50 mils, and the doctor's name is clearly written and signed. There's a concentration of 1 milligrams per mil, and she's allowed 3 syringes with a PCA dose of 1 milligram. The lockout interval is 5 minutes. The base infusion, there is no base infusion. The hourly dose limit is 12 milligrams. And the doctor signed that clearly as well. She's also been given antiemetic for the nausea that might cause, and naloxone for if there is a overdose or any reaction. And she hasn't been given any syringes, which the patient confirmed as well. And so I would like to get that. Is that a valid order by you?
Yeah.
Yep, it is through the IV narcotic analgesic chart.
Yeah, correct.
Thank you. Okay, so we are going to now do our drug calculations. We have here morphine sulfate injection, 20 milligrams per 2 mils. That is our stock stream. So we are going to, this is our board book. It is also for morphine, 20 milligrams per 2 mils. They say that the balance is 25. Now we're going to do a calculations to see how many mils we are going to need. So we will just start. So we have 50 milligrams. We have 50 milligrams per 50 ml is the order. 20 milligrams per 2 mils is our stock stream. The volume required will be 5 mils, 2.5 vials. Okay? So these are our drug calculations. You're happy with that? Okay, so now based on our drug calculations, we will take out the number we will need. We will need 2.5 vials, so that means we will take 3 vials of the 20 ml. So that's our 3 vials of the 20 ml, 2 ml each vial. And we are going to write that into the book. So now if we take out 3, we will just check the balance, confirm that we had 85. Okay, so we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. That will be what is left, and we have 3 out. So 22 are out. And that was the 20 milligram. We are going to be giving 50 milligrams. And that is for our patient.
Okay, so I'm going to do my first drug check. This is my second RN.
Patient Miriam
50 milligrams.
Taiff. We will be discarding 10 milligrams. The name of the prescriber is Al-Taiff. My name. And signature. And if you could write your name and sign too.
Do you agree?
Okay. So now we have finished with our SA drug and our drug calculations. So now we have written in the book with our drug calculations, and we have our yep. So now I would like to do my first drug check with you. Okay, so we're just going to grab our saline solution.
Great.
So now that we have our equipment, we'll do our first drug check. Okay. So I have Miriam Adib today, MRN 174963. She has had broken ribs. She has no known allergies. She's been written up for morphine 50 milligrams and 50 ml. As an IV narcotic. The concentration is 1 milligram per ml. Number of syringes is 3. This is her first syringe. She hasn't given any other out. The dose is 1 milligrams. The lockout time is 5 minutes. The baseline is 0, and the hourly dose limit is 12 milligrams. Doctor is clearly signed and dated, and we have here morphine sulfate injection, 20 milligrams per 2 ml, and we have 3 of those. So we will be discarding 1 ml to make the right 5 mils that we need, according to our drug calculations. And we also have that is within date, 10th of the 19th, and it's the right concentration. And here we have sodium chloride injectable, 10 mils each, which will need 45 mils. And so we will be discarding 5 mils of that, which is all within date, March the 17th. All of them are correct, and they're 0.9%. So that is our first drug calculation. So now we're going to prepare our medication. Yes, I'm just washing my hands first. Okay, so we have all of our equipment on our tray. We will now start preparing and do our second drug check. Okay, so we have okay. We will start with drawing up our morphine.
So we have blood pressure level a bit. I have photocardiac agitations and my second with post-fracture and so you have no more energy. And then the order is 50 mg and 50 mg. So we have morphine. Morphine in 10 mg and 2 ml according to my definition and and should be given a normal saline, so normal saline,
Now,
and the white shade is mass 170, and I have drawn and the doctor is only delivering and
we have
it's a piece
Vitic
also this is 1 mg number of syringes are 2. EC dose is 1 mg, knockout interval per minute. There is no conservative in weight, so our next dose limit is 12 mg. The doctor has sounded 2000 mg.
5 milligrams. 5 mils actually. Okay, so now we will pass the call.
I just did my second drop and on
Prime, Richard and Prime, winner,
I'll do my drop
and I'll check if they move material. No, it's still 50 ml because the fluid was 50 and
I
the
know what so it's alright, do it like that. So I'm gonna do the
March 17th. Yeah. Okay, happy with that? And we've got 50 milligrams. I'm just going to write down.
Okay, and now we're going can see me a bit more. So we have leftover. Just make sure that there are no okay. So we're happy with that. So we're just going to discard this syringe. Place. Okay, and now that we have done this, although I want to keep this sterile, but I do need to have the label as well. So what I'll do is, I will just quickly pop this on top to keep it in a sterile environment. And I'll just quickly prepare my label. Okay, so it's Miriam Al-Taiff, it's a 463, so the first 69, morphine 50 milligrams, 50 ml. Okay, so the time is 22:10. 5 minutes to 10. So that is, it is 9:35. Okay. Okay, and while we're doing this, we will also do our second drug check. I'm just going to put the label in such a way that okay, so let's do our second drug check. So I have Miriam Al-Taiff today. Date of birth 7th of the 1st, 69, MRN 1744963. She has come in with broken ribs. She has no known allergies. She's been written up for morphine for her pain, which is 8 out of 10. 50 milligrams for 50 mils, what the doctor wants. Clearly name, signed, dated, and contact details are there. Concentration 1 milligrams per mil. Number of syringes 3. None have been given yet. Dose is 1 milligrams. Lockout interval is 5 minutes. Basal infusion is 0 milligrams per hour. Hourly dose limit is 12 milligrams. So the doctor's clearly initiated it and ensured it and signed. We have here morphine sulfate 20 milligrams per 2 mils. So we have 3 of those. We discarded 10 mils and we have the other 5 mils in the syringe over here. And we also, the date is clearly there, expiry 10th of 19, all 3. And we have sodium chloride injectable, 0.9%, 10 mils. We have 1, 2, 3, 4, 5 of those, and one of them was not completely used, so that's for discarding. So altogether we have 50 mils in our syringe, and we have it labeled with the morphine 50 milligrams and 50 mils, 1 milligram per mil, which is as per requirement. So we are now ready to go and do. We are ready to get the plastic and also go to the patient and see the patient.
Okay, we're going to start connecting with the PA now.
So, this is the shop, so I will be discarding that. Okay, so the fluid is nicely through. As you can see, there's no air bubbles. Okay. So we're now ready to go and do our second patient check. Hello, how are you? Okay, so now we're ready to do our second patient check. Hello, I'm back. How are you, Miriam? Okay, so I've got your medication ready for your pain. I'm just going to get you to give me your name and date of birth again.
Yes, Marion.
Yeah.
On the 7th of 1st, 69.
Very good. And your MRN is 174963. Okay, and do you have any known allergies?
No,
Okay. So, and have you been given any medication today?
not yet.
Excellent, very good. So I've got your medication ready for you. I'm just going to start up the machine and do my last drug check. I'll be back with you. So here's the buzzer still with you. Okay. So could we just do our third drug check?
Yes.
Okay, so I have here Miriam Agate, date of birth 7/1/69, MRN 174963. She has broken ribs, no known allergies. She has been written up for morphine, 50 milligrams and 15 mils. We have morphine sulfate injection, 20 milligrams for 2 mils. So we used 3 vials of that, which is within the 18th of the 19th. 10 mils was discarded. And we have 5 mils altogether in our syringe. Over here. And we have sodium chloride for injection to make up the 50 mils. And that is in here, and it's also within date, 0.9%. And we discarded some of that as well. So altogether we have concentration of 1 milligram per mil of our morphine. Number of syringes is 3. We're going to be giving the first one. The dose is 1 milligrams, which is accurate, and the lockout interval is 5 minutes. The basal line is 0. That means there will be no infusion going through by itself. It will only be when she presses it, and the dose limit is 12 milligrams in the hourly dose. And doctor is clearly signed. Name, date, everything is correct there. And we will now proceed to load up the machine and give the medication to our patient. So. We will start by turning our machine on and opening up our machine. Placing the syringe so that you can see the numbers and you can see the patient's name so that you can keep track of the medication as it's going through.
This is a DC button, and as you can see, this is a light green one.
Okay, we will also quickly have a look at the cannula site to make sure that the integrity is still good
It's flashing now, it means the medication is.
before we actually connect up our.
When it becomes dull green, it means we can press it. You have to
So I'm just going to put this here.
Going back to light green, you can press it again.
Okay, so Miriam, I've got the medication. I just want to have a quick look at
Let me know if you need anything else.
cannula site.
Yeah.
Okay, so over here we have no redness, no swelling, and is there any irritation for you?
No.
No? Okay, very good. And the date is within date. Okay, so now we're going to wipe the entrance with alcohol wipe.
That's the main.
I just administer medication, and the side effect of the morphine is you might feel dizzy.
I'll work it out. I'll do it to my son's computer.
So now we will set up the machine
I got some medication.
for that. We'll just do a line, comfortable position. And we will.
Is everyone feeling is it not
So now,
okay, no, that's great. If you just want to take up some people waiting to come. Remember, it doesn't have to be perfect.
turn on. Okay, clear patient information. Yes. Yes. Okay. Okay. Yes. Okay. So we have morphine at 1 milligram per ml. So we have here morphine at 1 milligram per ml, PCA dose of 1 milligram. Lookout 5 minutes, no continuous flow, maximum 12 milligrams per hour, and that is all as per doctor's orders. So we are now happy to go on with this. So we confirm it by turning the key. Confirm protocol. Okay. Machine seems to be slow in reacting. Okay, I'll just put the notes down. Okay, so confirming protocol. And now we have to confirm syringe is 50 ml syringe, yes. Start the infusion, making sure the pump is off, everything is in place, and the key is in the right position. So start. We are now infusing Miriam. I did not. Okay, so Miriam, how are you feeling?
I'm okay.
Okay, so the medication is now flowing, and it's all being hooked up nicely. Whenever you need any drugs, just make sure that you press the button. Okay, so whenever you want to have some pain relief, just press the button. So I'll just get you to hold that. And whenever you want to, just give it a press, and then you should have a dose of morphine. Every 5 minutes, you can do that. If you need anything else in the meantime, just give me a call with the buzzer, and I will be available for you. Okay? In the next few minutes, I'll be coming back with reports anyway. So remember, you might feel drowsy, and if you're feeling more sleepy, make sure you let me know as well. Okay? Thank you. No problem. Take care. Okay, so now I'm just going to write up my notes. Okay, so I'll use the red marker. It's okay. I'll use a pen. The red marker marker.
So I'm just going to do your ID check first. So just like difference in notes. So I have to do these giving morphine because I understand that you fractured a rib, so I'm assuming it's quite a bit of pain.
Okay, thank you. So, right
Yeah, you're
here.
fine.
Oh, I'm the patient.
So,
Yeah.
today's date.
Ah, sorry. Yeah.
Time lined up for the patient is 9:45.
I'm just going to record and measure your vitals.
And my initials are.
Just give me a second while I validate the order. So I have Miriam, yep, and date of birth. I'm going to say mine and then write the full name. So I'm just going to put patient label and I can grab my history, fractured ribs, so I'm just going to start off with nerves and we're giving her morphine.
Can I see?
So this is your full name, please?
Okay, so now I'm going to just clean up
I'm going to
and wash my hands. Thank
Thank
you.
you.
Finish?